Today's video is about the exercises you should be doing and the movements you need to avoid in the first month after a SLAP lesion repair. Hi everybody, welcome back to the channel. So what exactly is a SLAP lesion? It's a tear to a structure in the shoulder called the glenohumeral labrum, or labrum for short. This is basically a ring of cartilage that lines the rim of the shoulder socket. And this helps deepen the socket a bit and stabilize the shoulder. Now, the top portion of this labrum can be torn, partly because part of the biceps muscle attaches right on it. And when throwing athletes rear back their arm to throw, that biceps pulls on the attachment point and over many repetitions and with a lot of force can tear the labrum. And in some cases, surgery is needed to repair this. Now, after surgery for about the first month, therapy has to progress really carefully because that newly repaired tissue is very delicate. It's easy to re-tear. So in today's video, I'm going to go through the exercises I most often use with my patients in this situation. They've just had a SLAP repair. They're within that month from surgery. They're usually starting therapy within a week or maybe two. In addition, there's a bunch of movement restrictions that we have to keep in mind, again, to protect that newly repaired tissue. So first we'll go through the exercises, then I'll go through the movement restrictions that you have to keep in mind during this first month after surgery. Before I demonstrate the program, I want to remind everybody, click those like buttons, subscribe, leave a comment, let me know how you're doing after your SLAP lesion repair. So first, grip strengthening. Seems very basic, and it is, but you'd be amazed how much grip strength you will lose for a month during which you can't use that arm at all. So, tennis ball is perfect for this. You can be in your sling, or during therapy, you can be out of your sling. Squeeze, hold, 5 seconds, relax. Squeeze, hold, 5 seconds, relax. Do this 15 to 20 times. Now we're going to work on shoulder range of motion. So I'm going to use my chair. You can use a countertop. You're simply going to place your hands on top of the chair or countertop and step back until there's approximately a 90-degree angle between the arm and the spine. So let's say in this example, my left arm is my hurt arm. I think you can see there's about a 90-degree angle between my arm and my spine. That's as far as we want to go at this point. Then come back to upright. Brief break and repeat. Again, no farther than a 90-degree bend between the arm and the spine. Hold about 5 seconds. Come back to upright. Do this 10 to 20 times. One of the things that's really helpful to improve in the early stages of rehab after almost any shoulder surgery is mid-back mobility. We need some mid-back flexibility in order to throw most effectively. It takes some stress off the shoulder if the spine has a little more mobility. Also, when you're wearing a sling all day for a month, your mid-back gets really tight and uncomfortable, and this helps mitigate that. So I simply have a rolled up towel behind me, right about at the middle of my back. I might even have my sling on, or I just have my arms crossed, and I'm simply gonna lean back and look up and hold this position 10 to 15 seconds. It actually feels pretty good. Relax and repeat this 5 times. The next exercise is a super common exercise, almost universally used for patients who have just had any shoulder surgery. This is called the pendulum exercise, or sometimes called Codman's exercise. But I see patients do this wrong a lot, and here's what I mean. So, as the name implies, the pendulum exercise. I let the hurt arm hang down, I shift my weight from one foot to the next, and my relaxed arm simply swings like a pendulum, right? But what patients do wrong almost all the time is they don't start with a relaxed arm. They have a stiff arm and they simply force it back and forth in this manner. This engages some of the shoulder muscles that we want to avoid engaging. So first step, let the arm hang. Feel the arm relax. Then simply start to shift your weight from right to left. The arm will swing very naturally and freely. Do this for about 30 seconds. Then relax. And do this 3 to 4 times per day. Somewhere around 2 weeks after surgery, we can start moving the elbow a bit. The reason we have to wait is that it does use the biceps muscle that I mentioned earlier. When we move our elbow, our biceps is working a little bit, and so we have to be a little bit careful with that. But there's no way you can get around some arm movement. So again, at about 2 weeks post-op, this exercise is safe. Very simply, bend the elbow as far as you can, straighten the elbow as far as you can. We're simply trying to prevent elbow stiffness, which, again, it seems kind of basic, but you're in a sling for a month, your elbow's going to get stiff. So again, about 2 weeks after surgery, start doing elbow flexion and extension, no weight, about 20 to 25 reps, 3 to 4 times per day. Also about 2 weeks after surgery, it's safe to start gently strengthening the rotator cuff muscles. Here's how we're going to do it. I'm going to use this chair. I have the chair stabilized with some weight. Elbows bent 90 degrees. I'm simply going to gently press the back of my hand into the chair. This should produce no pain whatsoever. I'm going to hold this 5 seconds, relax. Push, hold, 5 seconds, relax. 10 to 15 repetitions. Then I'm simply going to put my hand on the other side of the back of the chair. So now my palm is pushing into the chair. I push my palm into the chair gently. Again, these are called sub-max isometrics. It's gentle, okay? Push, hold, 5 seconds, relax, 10 to 15 repetitions. I mentioned in the intro that there's movement restrictions that we have to abide by during this first month after a SLAP lesion repair. And the point of these is simply to protect the repaired tissue. It's not healed sufficiently to withstand the rigors of movement. So first off, sling use. Pretty much 24/7 for at least the first 3 weeks. That may vary a bit from person to person, from surgeon to surgeon, depending on what exactly is done in surgery. But for the most part, count on 3 weeks in the sling. The only time you're out of your sling is if you're showering, you're in rehab, you're getting dressed. That's pretty much it. You're even sleeping with the sling on. Also, no reaching with the arm. You can't reach at all. That engages some of the muscles in the shoulder that may stress the repair. Kind of related to that, no lifting or carrying. You know, I've had patients do this, for example. They'll carry something while they're in their sling and they'll think to themselves, or they've said to me, hey, I'm not reaching. Yeah, but you're carrying something, so stress is transmitting through your shoulder, and particularly your biceps muscle is working. And remember, in the intro, I mentioned how the biceps is attached to that repaired portion, and any stress within the biceps can damage the repair. So, sling use 24/7, no reaching, no lifting or carrying. Those are the exercises I usually use with my patients who have just undergone a SLAP lesion repair. And those are the movement restrictions that are pretty universally used for patients in this situation. I hope you found this video helpful. I hope it helps you get back to what you love to do. Again, like, subscribe, leave a comment, let me know how you're doing after your SLAP lesion repair, and we'll see you in the next video.